Okay, so we're going to be talking about kind of the anatomy of some of the respiratory system. So here we have our airways shown, and so it's kind of broken into two zones. We have our conducting zone and our respiratory zone. Our respiratory or our conducting zone lacks that alveoli, which is where gas exchange happens, and so our respiratory zone has alveoli, which therefore is the place of gas exchange. And I wrote down here, no alveoli, no gas exchange. So as we move into here, we can see kind of one cycle of our respiration includes inspiration and expiration. So the purpose is to get our air in and out of the system, and to exchange the gases, we need our alveoli and our respiratory zone. So it's helpful to kind of visualize this. So as we move down here, we can look a little closer. So this is kind of a zoomed in on a terminal bronchiole. So here I wrote we have our oxygen, which is bringing it through a pulmonary vein, and this is deoxygenated through a pulmonary artery. So here we have on our terminal bronchiole, we have smooth muscle wrapped all the way around. That's so that it can kind of control how much blood and gas exchange is going on based on like the constriction. And so we have each like little alveoli here, or alveolar sac, depends however you want to say it. And we have our capillaries. These capillaries are wrapped around each individual sac to allow for that gas exchange and that movement. So just kind of two different pictures here to visualize, and you can see really like how zoomed in it starts there, and then it's so little. But yeah, so as we move down here, we can look a little closer. So what is alveoli basically? So they're hollow sacs, and they're continuous with our airways. So this is allows for that, gas exchange and all of that that we need happening. So there's two types of cells that are important in our alveoli. There's type 1 and type 2. And our little definitions are type 1 is flattened and columnar. So this allows for gas exchange. And then we have our type 2, which are squamous cells. And this is a little bit more specific. And so I'll go into a little more detail on the next slide for this. But these are just good pictures so you can really see how close our like capillaries are with our alveoli. Super close to allow for that exchange to happen. So as we move into here, we can look more at type 2. So type 2 kind of deals with surface tension. So this is a really zoomed in picture of an alveoli. And we can see that there's a bunch of molecules of H2O lining this epithelial um, surface. You can see that right here. And I wrote that out, molecules of H2O lining the epithelium. So what type 2 does is it secretes surfactant. Surfactant is kind of, you can think of it like detergent. And so what it does is it decreases those cohesive forces between the water molecules. If you stretch your type 2 cells, it increases surfactant. It's like a big deep breath or something. But so kind of to explain this a little more in depth, so H2O has cohesive forces and they pull all of it together. So they try to basically kind of like collapse um, the alveoli. So pull the walls of alveoli in. And so you need something to kind of break up those cohesive forces so that you don't collapse your lungs. So surfactant decreases those forces. So it's like a detergent, and it's really needed because that's what allows us to, keep breathing, and so we don't have that collapse. And yeah.